Hello and welcome to 3 and 3 in Black History at Fielding Graduate University. My name is Lisa and I'm a member of the Inclusion Council here at Fielding. And today we have with us Tahlia, who is the president of the African American Student Association and a clinical psychology doctoral student. Thank you and welcome, Tahlia.
Thank you.
And so for our first question to get started for the month, we want to ask you in 1 minute only why you selected your topic for your dissertation.
That's a very great question. My topic for my dissertation is looking at the impact that cumulative life stress accrued in childhood has on overall quality of physical health and risk for developing advanced cognitive aging in African Americans. And I chose that topic specifically because African Americans are at a pandemic for dementia-related disorders. And as the baby boomers generation progressively ages, this is only going to further extrapolate. And I think it's imperative now that we begin to look at some of the causes and other variables of onset. We've looked at physical factors such as heart disease and diabetes, but we haven't looked at how stress in childhood could mitigate or moderate the relationship of developing such diseases, which therefore impacts cognitive decline as they age.
Thank you so much for exploring that important issue. And our next question for you is, what do you think about when you hear Black History Month?
I think of legacy. So much in media today really emphasizes how much further we have to go. But I think Black History Month is a silent pause to reflect on how far we have come. Of course, there's going to be more strides and progress that need to be made, but we have came so far just in the post-Reconstructive era after slavery has ended and emancipation was given. And I think that there's a lot that is still not spoken. I think it's an atrocity that social media teaches more Black history than our public schools do. But I'm glad that there's now a voice and a platform and a consistent medium that does promulgate and influence and inspire others by telling our history, because Black history is American history.
Yes, definitely. Thank you so much. And for our last question for you, tell us about one way that your cultural heritage contributes to a positive environment as a student at Fielding, considering our 45th anniversary in creating an inclusive culture here.
I am unapologetically and very proud to be a dark-skinned, natural-haired Black woman. And I do not make any airs or any qualms when I enter a room to erase any part of that part of my identity, to make others feel comfortable or to assimilate, if you will, into that. Of course, being an American natural-born citizen, I'm by default in some ways acculturated to the dominant American culture. But by inviting my qualities that are not shared with the dominant culture to be in the forefront of a conversation or just to be present, I think is what I bring to the table. And then inviting the conversation of how this could or could not impact patient care or research.
Yes, and thank you so much for your work in the community and for joining us today and sharing your insights, Tahlia. And we'll see you all next time in the next episode.
Thank you so much.